Support for the statewide broadcast of The State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris, and Arthur, LLP. When dealing with legal issues facing businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. And from the Ohio Education Association, representing 124,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.
72,000 people around the country died of drug overdoses last year, according to the Centers for Disease Control. In Ohio, there were at least 4,735 people who died, 13 people a day, or one every 2 hours. An in-depth look at what's being done about Ohio's opioid crisis. This weekend, the state of Ohio. Welcome to a special edition of the State of Ohio. I'm Karen Kassler. Those 13 people who are dying of heroin, fentanyl, prescription painkiller, and other opioid-related overdoses every day in Ohio, they all have parents, friends, neighbors, co-workers, and kids. The Public Children's Services Association of Ohio says half of the children taken into custody had parents who were using drugs. And the Ohio Department of Health estimates 84 babies are being treated each day for drug withdrawal. Joe Ingles reports on how families, caregivers, and advocates are connecting to care and helping with the trauma, confusion, and devastation left on kids by opioids.
For some children of drug-addicted parents in Ohio, the struggle starts the moment they are born.
The numbers in 2015, we had 2,100 babies in Ohio that had to go through withdrawal, and the number's increasing.
That's why Jill Kingston says the facility in Kettering that she operates is needed. It provides the medical treatment that is given in a hospital in a comfortable, home-like setting.
So when a baby goes through withdrawal, you might see them shake a lot, and it's called tremor. They have a high-pitched sound that they scream, they cry a lot. They have a difficult time feeding.
She says the number one comfort for a baby suffering from opioid withdrawal is being held in someone's arms. These drug-addicted babies at Bridget's Path are cared for 24 hours a day, 7 days a week, until they've finished their medicated withdrawal. And while that's happening, people at the center are working with the mother to make sure she's getting treatment. And they work with Children's Services to hopefully find a family member who is willing to take care of the baby until the mother is clean and able to take care of the infant on her own. Kingston says sometimes the babies cannot be placed with family members, so they have to be put into the already burgeoning foster system. That's a problem Christy Burry knows all too well. She says 8 out of 10 kids now in protective custody in Fairfield County are there because of parental substance abuse. And she explains 65% of them are placed outside Fairfield County and spread throughout 30 counties across the state.
When we can't keep a child close to home, that means they're leaving their community, they're oftentimes leaving their school, they're leaving their friends, they're leaving their church, they're leaving their social activities. So when we think about the impact that has on a child's mental health, and when we look at that through a trauma lens, no wonder they're having all kinds of issues.
Burry says many of the kids coming into the system now have experienced trauma significant enough that they require mental health treatment. She says a few years ago, about 3% of the children taken into protective custody required care from a residential treatment center.
25% of the children that we have to take into protective custody are in a residential treatment center setting, not in a family foster care setting. And to add on to that, that 25% of those kids accounts for almost 65% of the costs associated with taking care of those kids. It is expensive. Many of those facilities are $300, $400, $500 a day just for one child. So when we
and those treatment centers are often in other states. Burry says the agency has been forced to send some children needing treatment as far away as Missouri. That's a problem when parents receiving addiction treatment want to reunite with their children. Valerie's two sons, 9 and 12, have been living with their grandma while their mother tries to beat her opioid addiction through a program at Amethyst in Columbus. It's a far cry from just a dozen years ago when Valerie was a straight-A student in nursing school. But after her mother passed away, Valerie says she couldn't cope, so she turned to drugs. When she couldn't afford the drugs, she turned to soliciting, which landed her in jail.
My addiction took me to a place where I wasn't even able to call and check on my kids. I missed birthdays, I missed holidays, and that's something I'll never be able to get back to them. But I pray to God that they learn from me. With their dad being in addiction as well, when he overdosed, they were there to find him. They found their dad.
Valerie is working to get her children back with her.
But they have so much going for them right now, and I'm actually working towards visits. I talk to them almost every day. We FaceTime, and they're in a good position. They're in a better place right now than I could have given them at the time.
Once Valerie is stable and regains custody, the kids can live with her at Amethyst, where they will also receive counseling and programming.
We want to make sure from a program standpoint we're able to support her and her parenting skills and also address the needs of children, because we do have several women here who have their kids living with them, which is kind of a uniqueness about our program, that they're able to still have that attachment and bond while their mom's going through treatment, which is really neat to see.
Amethyst is the only gender-specific treatment center of its kind in the state and one of 3 in the nation that allows children. And it's always full, serving an average of 400 women a year.
Yeah, so for a complete year, it's just under $10,000 for each client per year. But that includes everything. That's the intensive treatment, that's the summer camp program, that's our after-school program, it's the food, it's the clothing, it's all of those support services. A good point of comparison is it costs over $22,000 to incarcerate somebody each year. So if you think about that, we're half the cost of incarceration. Our research shows that we're more effective, and we prevent a woman from going to prison, being separated from her family more permanently, and then coming out of prison with those collateral sanctions of being an inmate in Ohio.
Linda Janes says more needs to be spent on treatment, but she says communities also need to be more welcoming to treatment centers such as this one.
And I think we have to work as a system to break down those stigmas and to explain to people that if we don't provide treatment and housing, these people are going to be back out in the community, they're going to be back using, potentially committing crimes, and worst case scenario, dying. We're going to continue to lose our brightest young people that have fallen to the disease of addiction.
Janes says communities need to realize everyone is affected by opioid abuse, even if they're not personally affected by it. Joe Ingles, State House News Bureau.
Communities in every part of the state have been damaged by opioid deaths. Last year, for the first time, there was an overdose death in every single county in Ohio. Dayton and Montgomery County led the state, but rounding out the top 5 are all rural counties: Fayette, Clinton, Clark, and Brown. The CDC says the rural overdose death rate has been higher than the urban rate for a decade, and those rural communities are struggling to get a grip on handling that.
Roger Weinmiller farms 3,400 acres in the small community of Blanchester in Claremont County. There was a time when he admits he didn't want to talk about what happened to his family. But the nation now knows, thanks to a front-page story in the New York Times. Roger lost 2 of his 3 kids to opioid overdoses, and his surviving son has been in recovery for 19 months.
there's no words to describe the darkness. None. It's been hell. It's been a living hell. But I tell people that, when someone has, say, terminal cancer, they give them morphine to make them comfortable. Okay? What I do by reaching out to addicts and the families and doing what I can to spread awareness, help raise the stigma, and to help educate people is my morphine to my pain. Because the pain today is just as real as it happened 2 years ago. It's not any less. It's there. And every day, multiple times during the day, I walk back that hallway to that same bathroom where I found my dead daughter at.
Weinmiller's terrible, tragic story is also not terribly uncommon in rural areas. It's at home and on the farm and in the church, which is often the heart of a rural community.
When you do the math in Ohio, 1 out of 3 folks are being impacted by the issue in the state. So one of the things we try to encourage and tell the church is, church, those folks that are dealing with this are sitting in your pews already.
And Delaney knows. He got sober after a pastor visited him in the hospital during his 18-year battle with alcohol. And he's now a leader of a church that serves hundreds seeking help for addiction, just blocks away from Xenia's illegal drug hub, and 20 minutes from Dayton, the state's opioid overdose capital. The church's ministry includes a men's sober living house, a pay-what-you-can-afford cafe, and a program to help deal with what he calls the ripple effects of addiction: homelessness, hunger, and poverty. Delaney says there's a place for faith in this fight, even for non-believers, because churches can bring together partners from all over. His idea of recovery as a mission for the church got him a gig as the faith collaborator for the Ohio Attorney General's Heroin Outreach Unit, and landed him an invitation to the White House in March. But all that attention doesn't necessarily help rural residents recognize addiction as it's happening and knowing what to do when it does. That's why groups have been reaching out, including the rural community tradition that was founded in Clark County more than a century ago, 4-H. They're talking about preventing and fighting the opioid crisis at county fairs and at the huge annual Farm Science Review exhibition in London.
I think that maybe the misconception is that it's something that is happening in our urban areas, and certainly the numbers are greater there, but the rate is actually higher in our rural areas. And I think maybe it's more hidden. Maybe there's not the resources necessarily in our rural areas that can help with the addiction problems. So I think it's gone unnoticed, but not any longer. I think people are starting to become much more aware of that.
That closeness in rural communities can be an advantage if the community learns to understand addiction. Delaney says that's also part of his mission, not just showing addicted people they can turn to the church, but educating church people not to turn away.
Right now, the addicted community often look at the church in 3 ways: as homophobic, as hypocritical, and as judgmental. And so if I'm struggling with something, I'm not going to go scratching on that door because I don't like what's on the other side. So it's helping the church to understand you've got kind of a misperception out there in this public. But then on the other side, how do you create a welcoming social environment so that people can feel like, oh, they get me. They're not going to judge me.
And Weinmiller says that message is critical, that people battling addiction need to know that they're loved, even before they seek help. And that can be tough in a small town.
There's a different type of self-pride and respect that I think carries in the rural communities more so than in urban communities. And because of that, a lot of times it stands in their way from opening up and asking for help. I will say that at one point in time, I don't ever want to say I was really embarrassed about what my kids did, but I didn't really talk about it. And then, way before I lost my kids, I would, if it would come up, I would talk about opening what I knew, but at that point in time, I wasn't really educated on it. Not connecting it with my own addiction of smoking that I am currently trying to give up on my own. But so don't hold it in.
Among the complex reasons for the high rates of opioid use and overdose in rural areas is that treatment can be hard to find and far from home when it is. A study released last year from Ohio State University's SWANK program in rural urban policy found Ohio has enough treatment capacity to reach only 20 to 40% of the up to 170,000 Ohioans who need it.
Among the complex reasons for the high rates of opioid use and overdose in rural areas is that treatment can be hard to find and far from home when it is. Many times, connecting people to care is about removing barriers, including a much-discussed policy that advocates say may have once served a purpose with treatment, but is now an obstacle in this fight. Andy Chow reports.
My life was very unmanageable. I was losing everything.
This is Jacqueline Abney of Cleveland.
I lost houses, my car, my kids, and the respect from my peers at work.
And this has been her home for the past month.
It didn't seem like it was an institution, and that I was really scared of. So it was homey, and I thought, okay, I might be able to handle that.
Jacqueline is living in the Beacon House. This residential treatment center looks just like any other home you would see in the historic downtown area of Worcester. The only difference? She's living with several other women struggling with substance abuse disorder. They cook for each other, play games, work out, and get counseling all under one roof. Jacqueline had been fighting an addiction to heroin, which evolved into meth for 7 years, until one day she lost her job.
So I thought, okay, enough is enough. You're 40, let's do something. So I called up here.
And Jacqueline emphasizes just how important that first phone call can be for an addict.
And they call that the 900-pound phone, that you don't want to, the phone's there and the help could be there, but to actually pick it up and do it is probably the biggest and first step in recovery, I think.
Thank you for calling 180. This is Peggy.
There's no shortage of phone calls here at the 180 Crisis Center, which runs the Beacon House. Mental health and addiction experts agree with Jacqueline that picking up the phone and making that first call is vital for anyone seeking treatment. But 180's executive director, Bobby Douglas, says facilities in Ohio and around the country are running into a major challenge.
I think one of the issues that we have is that the federal government actually restricts residential treatment centers to being able to have no more than 16 beds. And sometimes communities need more than 16 beds.
The bed limit is known as the Institutions for Mental Diseases Exclusion, or the IMD rule. It says the federal government cannot issue Medicaid funding for any facility with more than 16 beds. It's meant to discourage the flow of money for large mental health institutions. However, it's having what some see as an unintended consequence, forcing centers to turn addicts away because they've reached capacity. Douglas says there's a sense of urgency when it comes to connecting people with treatment right away.
So what we want to do is remove the barriers so we can get people into a place where hopefully they start to see that there's a different way, and then they become motivated for themselves in terms of wanting to get better.
Republican U.S. Senator Rob Portman agrees with that sense of urgency when it comes to connecting people to care.
There are so many heartbreaking stories of people who are ready for treatment. They go to a treatment center, find out that there's a wait. During that interim period, they continue to use. In a couple of cases, specifically in Ohio, those individuals have overdosed and died.
Portman is seeking a measure that would either raise the bed limit to 40 beds or get rid of the cap altogether. But there's a dilemma. That kind of bed limit increase can hike up Medicaid costs by as much as $10 billion. Portman says he's working on a plan that could bring that price tag down to around $2 billion. And he's making his pitch to the U.S. Senate and U.S. House.
Well, I say there's a crisis. I say it's urgent. I say we've got to do something now before this issue gets even worse. We're losing more people every year to opioid overdoses than any other single cause in Ohio.
Douglas supports raising the bed limit and says there's a way to rein in costs even with an increase.
There's an economy of scale that comes so that you can provide more treatment to people at a lower cost, and hopefully just as effective if you can have 24 beds, I think is the number I always hear that's kind of an ideal number. So when you're limited to 16 beds, it makes treatment sometimes more expensive.
Governor John Kasich and his administration has also recognized the problem with bed limits. In fact, his office has put out a letter stating that the rule should not be applied to residential centers, such as the Beacon House. Lori Chris is CEO of the Ohio Council of Behavioral Health and Family Services Providers. She says the Kasich administration's opinion can help facilities, but there's still a level of ambiguity.
It is a little bit confusing because the federal regulations seem to point to a different interpretation, but the Kasich administration has clarified in writing what their interpretation is, and providers in the state of Ohio are regulated by the state of Ohio.
A change on the federal level would create more stability for treatment centers trying to follow the rule, especially considering Kasich is term limited and the next governor may view the rule differently. As for Jacqueline Abney at the Beacon House, she's 21 days sober.
For the first time, I see the light. I just don't say, oh, there's a light at the end of the tunnel. I really see this light, so it's amazing.
And she's grateful there was a bed ready for her when she decided to pick up the phone and call for help. Andy Chow, State House News Bureau.
Over and over, health experts, counselors, advocates, and people and families struggling with addiction say there simply isn't enough treatment available, especially at the moment when a person who's addicted is ready for it. A study released last year from Ohio State University's SWANK program in rural urban policy says the state only has enough treatment capacity to reach 20 to 40% of the up to 170,000 Ohioans who need it. It also showed the opioid crisis cost Ohio up to $8.8 billion in 2015. And state spending on the crisis has not kept pace with the increase in overdose deaths. Ohio Department of Mental Health and Addiction Services Director Dr. Mark Hurst and Public Safety Director John Bourne are part of the Kasich administration's front lines, managing the money spent on Medicaid, law enforcement, and other services and programs.
It's about $1 billion that the state's spending on the opioid epidemic. A large part of that is Medicaid funding for treatment services. And in fact, well over half of it is for that. But in order to deal with this effectively, we need to have a multi-pronged approach with that, which includes prevention, early intervention, or being able to identify the issue before it becomes an addiction, effective and evidence-based treatments, which includes both the counseling approaches and medication approaches, and life-saving measures such as naloxone. And all of those are represented in the funding.
Let me turn to you, Director Bourne, and ask you, we've often heard that we can't arrest our way out of this, though there's been a lot of emphasis on what law enforcement can do here. What can law enforcement do, though? I mean, when you're dealing with people who have an addiction, a problem. I mean, you do have drug dealers and people who you can arrest for crimes, but what about people who are addicts, who are struggling?
Well, it's a great question. You know, in 2011, we shifted the entire focus of our law enforcement efforts in Ohio, and particularly with the Ohio State Highway Patrol, and began focusing on supply lines. We knew that because of Ohio's interstate network, because of our location geographically, that we were a key center, and so we began looking for ways that we could interdict the supply so that we could both disrupt the supply, and you note that I didn't say stop the supply, but disrupt the supply, increase the cost, and increase the risk. And in the last 7.5 years, we've seized more drugs than ever before. And some of those seizures, you think, okay, well, it's not having any kind of an impact. Well, if you seize 16 kilos of fentanyl, as we did out of a traffic stop, that's literally hundreds of thousands or millions of lives that have been impacted that night. Now, long term, as the doctor said, the key is on the demand side, and not only the people that have entered that unfortunate cycle of addiction, but trying to keep people out of that first use. And that really is the key. Law enforcement plays a critical role, not only in obviously the interdiction and the supply line, but in the education efforts as well. And so we began a program called 5 Minutes for Life. It's just one of the programs within the Start Talking campaign that the governor and the First Lady initiated, and that was to try to stop that first use, because we know if we can prevent the first use, that we can prevent the cycle of addiction that follows.
You mentioned that a lot of the money, the $1 billion that the state is spending, is going to treatment through Medicaid. We found out from Medicaid expansion earlier this year that about 8% of people who are in Medicaid expansion got Medicaid-assisted treatment at least once through the program. That just seems low. Are you reaching all the people that you feel need to be reached?
Well, I think we need to have more uptake of evidence-based treatments. And in terms of medication-assisted treatment, there's no question about the effectiveness. effectiveness of it. It cuts the likelihood of a lethal overdose by half at least. It improves the likelihood that people are going to be retained in treatment, that people are going to be employed, that decreases the likelihood of incarceration. So this is something that works. And all three forms of it, the Vivitrol, Suboxone, and Methadone, all are effective treatments.
But these aren't drugs that can be taken once. I mean, they're courses of treatment. You have to, if you're on these courses of treatment, have to keep going back and keep having them administered.
Yeah, I think I need to fall back to what I said earlier in terms of this is a chronic disease. So we need chronic treatment for this disease. So, just like if you have diabetes, you need to have treatment for the diabetes for the duration of the disease. It's the same for addiction. You can't have one dose or one brief episode of treatment and expect that everything's going to go well with that. It needs to be sustained over a period of time to have the best likelihood of success.
Bourne says strike forces, like the one recently announced in Northern Ohio, where treatment professionals are embedded with law enforcement, can make a difference. And Hurst says he's keeping an eye on marijuana as a possible solution to the opioid crisis, but he also says there are studies that refute that. Meanwhile, lawsuits filed by the state, cities, counties, and hospitals against several opioid manufacturers and distributors are proceeding. A Northern Ohio federal judge has set a trial date for a year from now for several of those claims. And that's it for this week. For my colleagues at the State House News Bureau of Ohio Public Radio and Television, thanks for watching. Please check out our website at statenews.org, and you can follow us and the show on Facebook and Twitter. And please join us again next time for The State of Ohio.
Support for the statewide broadcast of The State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris, and Arthur, LLP. When dealing with legal issues facing businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. And from the Ohio Education Association, representing 124,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.